Culminating Experience SPHL 50-70 and SPHL 7950-03. The online master's program Culminating Experience at Tulane University School of Public Health and Tropical Medicine. In this Culminating Experience map, I'm going to give you a brief overview of the completion of this requirement. If you are in the MSPH Industrial Hygiene Program, the Culminating Experience is mentored by Dr. Rando. Please contact him directly at rando@tulane.edu. If you're in the MPH Occupational Environmental Health, Occupational Health and Safety Management, or the Disaster Management, you have two options for completing the Culminating Experience. Option 1 is taking an exam. Option 2 is writing a paper. If you're going the exam route, you should register for SPHL 7950-03, Culminating Exam. You'll sit for Part A of the Culminating Exam. Once you have successfully completed that, you'll sit for Part B of the proctored Culminating Exam. If you decide you want to write a paper, you should register for SPHL 7950-70. This is considered a public health analysis paper. You'll send the topic of interest to Dr. James at dldirect@tulane.edu. Once you've agreed upon the topic, you'll send the written abstract with references to her as well. Finally, you'll work with your faculty advisor on the topic. Remember, Dr. James is your academic advisor. The project is considered complete when you submit the final electronic version and 2 bound copies of the manuscript to Dr. James. Details of the entire process can be found at this website. Who needs to do a Culminating Experience project? Everyone enrolled in a master's degree program, that is the MPH or the MSPH. When should you register for the Culminating Experience? Typically the last semester of your program or when all the core requirements have been completed. What is a Culminating Experience? The Culminating Experience allows a student to demonstrate their ability to integrate what they've learned and experience and apply it in a situation that approximates some aspect of professional practice. The MPH students at Tulane University School of Public Health online program have 2 options for completing the Culminating Experience: a written paper that is a public health analysis or a proctored cumulative exam. The MSPH and Industrial Hygiene students only have the option to do a thesis, which is mentored under the direction of Dr. Rando, and should contact him directly at rando@tulane.edu. If taking the exam, register for SPHL 7950-03. If writing the public health analysis paper, register for SPHL 7950-70. You can find the CRN, course registration number, on our home website under the registration tab. If you register for the written project, you can check Blackboard for examples of written proposals, completed written projects, and this slide presentation. Either the written or the exam candidates should refer to the published manual on the Culminating Experience. The manual can be found at this link. The exam route, that is SPHL 7950-03 route. You've decided to take the exam. I've decided to take the exam to satisfy the Culminating Experience. Is there a study guide? The Association of Schools of Public Health has produced a study guide for the National Certification Exam that is useful in the SPHTM Culminating Exam Part A, and it can be found at www.asph.org. exam option, and culminating experience. The exam consists of two parts, Part A and Part B. Part A is the master's comprehensive examination and covers the core classes. Part B assesses competency in the specific degree areas only and includes only your program-required courses. For instance, whether you're in the disaster management, OC health, or occupational health and safety management program, you have program-required courses, and Part B will only cover those classes that are specific to your program. Part A may be taken after only all the core classes have been successfully completed, and Part B may be taken only after Part A has been passed. How do I study for Part B? There is no study guide for Part B. Review your lectures, podcasts, and notes from your program-required courses. Both Part A and Part B of the exam are proctored. The proctor has to be a responsible person with an academic or professional standing and be in a supervisory position or associated with an established testing center. Examples of proctors include college, university, academic faculty members, commercial testing centers, a military testing or education officer, human resource manager, hospital education coordinator, embassy official, official in a ministry of health or other governmental agency. The exam proctor cannot be family members, relatives, assistants, co-workers, immediate supervisors, neighbor, friend, reside at the same address, another student, a secretary, office manager, administrative assistant. In other words, anyone with a conflict of interest or interest in the outcome of the exam may not proctor it. Proctor information must be provided to Erica Geary at dlinfo@tulane.edu by specific deadlines each semester. The deadline to provide proctor information and register for the exam are updated each semester and may be found on the distance learning academic calendar, and they change every semester, so make sure to check it regularly. When is Part B of the exam delivered? Part B of the exam may be scheduled anytime between Monday through Friday, and the date is decided together with Dr. James. Part B of the exam is scheduled only after Part A has been passed. Once you've passed Part A, contact Dr. James and schedule a time to take the exam. The proctor requirements for Part B are the same as for Part A. Public Health Analysis Manuscript, SPHL 7950-70. So, you've decided to write the paper. This part of the presentation will discuss the process to complete the paper. First, decide on a topic of interest to you. The topic can be work-related, it can build on a previous project that you may have written or done for a class or some other public health project. You can send the topic or the proposed topic to dldirect@tulane.edu, and remember to put in the subject line that this is your proposed topic for your culminating experience. Examples of completed projects can be found on Blackboard if you're registered for the -70 section of this class. Once the topic has been approved by Dr. James, write up a short description of your project. Here's an example of such a write-up. You can in fact find this example on the Blackboard site if you've been registered for the -70 section. Process to complete the culminating experience. Once your proposal has been received and reviewed by Dr. James, she'll contact you to discuss any changes that need to be made. You'll jointly decide who would be an appropriate faculty advisor on the topic. The faculty advisor is typically an instructor you've had that you'd like to work with and has some expertise in the topic that you've decided on. The remainder of the project is completed between you and your faculty advisor. Remember, again, Dr. James is your academic advisor. Completing the culminating experience. Once the project is completed, your faculty advisor will send Dr. James an email saying that you've successfully completed the written culminating experience. We ask the student to send the final electronic version of the culminating experience. Remember, again, in the subject line of your email, say, "This is the final electronic version of the culminating experience." You also need to send 2 hardbound copies of the final written culminating experience. The mailing address that you should send these bound copies to is Dr. Elizabeth James, Tulane University School of Public Health and Tropical Medicine, 440 Canal Street, Suite 800, New Orleans, Louisiana, 70112. One last thing. On Blackboard, if you are registered for the Culminating Experience class, that is the -70 section, you'll have access to examples of completed written projects. Please do not share these or post them online. Congratulations! Regardless of which route you chose to complete the Culminating Experience project, this is a significant accomplishment and one you can be proud of.